TB control is a global effort that is affecting the whole world. And since TB is an ancient disease that is recognized by World Health Organization as a major health threat, so therefore certain countries are prioritized for reducing TB in the countries, the prevalence and the incidence of TB.
Now, in 2017, Namibia recorded an estimated figure of over 1,000 TB cases. This is probably the latest. Do you agree with that without updated data and research, it will be difficult to control and manage TB for planning purposes?
The country is doing the surveillance and reporting systems are in place for TB control, and therefore the numbers are changing over time. There is information that can be captured from information that the Ministry of Health is providing on an annual basis. Yet, if the control measures are not vigorous, it might have an effect because there's the measurement that is indicating that there are missing cases of TB. Current efforts are indicating a slight decline in the number of cases. And of course, data capturing in the Ministry of Health is properly done and still reporting on a SADC level and on the global level.
And what are the specific contributing factors that increases the prevalence of tuberculosis among minors? And what are the measures that can be taken also to address these factors and reduce the incidences of the disease among minors?
We know that the operations of mining sector is contributing positively in terms of economics to the livelihood of communities and miners. Yet there are other contributing factors that has a consequence on the health of people. And those factors are, for instance, high level of illnesses among minors, ill health, and also disabilities that could hamper the gains that we can receive by the contribution, the economic contribution that the mining sector is giving to the people. Now the Southern African mining sector is tasked to look into analysis to identify key determinants that contributes to high disease among minors, especially tuberculosis and lung disorders among minors. And these analyses repeatedly identify key negative determinants, which is poor access to health and social services, non-harmonization of service delivery for TB and HIV and other conditions, and inadequate legal frameworks that address the occupational health related rights of minors and ex-minors.